Hi, this is Dr. Avinash Katara and I welcome you to today's webinar on sweaty palms. Sweating or perspiration is the production of a fluid consisting primarily of water as well as various dissolved salts, chiefly chlorides, that is excreted by the sweat glands in the skin of mammals. The human body has 2 to 5 million sweat glands all over it. Sweating is an important bodily function that allows us to control our body temperature and keep it within the normal range. We all sweat as a normal response to different forms of stress. This could be heat, exercise, or even emotional stress. Hyperhidrosis is the excessive sweating produced by the body that is non-physiological and disproportionate to that required for the regulation of body heat. Hyperhidrosis can be of two types. It could be generalized, where excessive sweating occurs all over the body, or it could be localized to a few particular areas. The commonly affected areas in this group of patients are the palms of the hands, the armpits, the soles of the feet, the face, etc. Excessive sweating could be primary when it occurs due to unexplained or unknown causes. Localized sweating, for example from the palms, are usually due to primary or unknown causes. Excessive sweating can also be secondary to other medical conditions like neurological diseases, endocrine disorders, metabolic dysfunctions, infections, certain malignancies, or due to the effect of drugs and toxins. Primary palmar hyperhidrosis is a medical condition which is commonly referred to as sweaty palms. It is characterized by the excessive sweating from the palms. It may seldom be mild, but more often than not, patients would have their hands dripping with sweat. It may be associated with excessive sweating from the soles of the feet or the armpits. Sweaty palms affects both sexes, all races, and often has a family predisposition. Sweaty palms usually begins in childhood. It gradually progresses during the teens and adulthood. The peak age of onset is 15 to 25 years, but we often find younger children distressed by not being able to write their exams because of their dripping hands. Sweaty palms is a common problem that affects people all over the globe. The incidence is about 1% in the Western world. In the Far East, it is up to the tune of 2 to 4%. In India, it is estimated to affect about 1 to 2% of our population. Regardless of which part is affected, excessive sweating is a nuisance to those who suffer from it. Of these, sweaty palms is the most incapacitating. There are significant emotional and physical disabilities from its nuisance. Patients are not only uncomfortable but often socially and professionally embarrassed by it. It can affect common day-to-day activities like shaking hands, writing, playing musical instruments, handling paper, painting, using electronics, computers, mobile phones, etc. It can be very distressing to the patients affected by it. Surgery for sweaty palms is the gold standard of treatment all over the world. It involves keyhole or minimal access surgery and only 24 hours of hospitalization. The sympathetic chain is a bundle of nerve fibers that runs from the base of the skull up to the tailbone. In the chest, it runs in the back along the ribs. Overactivity of the sympathetic system causes sweaty palms. Surgery targets blockade of the sympathetic chain. This minimally access procedure to block the sympathetic chain is called endothoracic sympathectomy. It employs the use of tiny keyhole incisions to gain access to the sympathetic chain deep within the chest cavity. This procedure is carried out under a general anesthesia. A few basic tests may be carried out before your admission to ensure safety of the procedure. Patients are up and about soon after the surgery and are kept overnight in the hospital for observation. Patients are discharged the following morning on a few pain medications and asked to follow up after a week. Endothoracic sympathectomy has immediate results and is a well-accepted procedure for sweaty palms. The effects are permanent in more than 90% of patients with minimal or no morbidity. Patients are usually happy with this procedure because there is a very drastic improvement in the quality of life after surgery. Please feel free to write to us on dr_akatara@hindujahospital.com. Alternately, you could call on 39818181 to make an appointment to see us. We will be more than glad to help you. We would be glad to take any questions at this time. Thank you for your patient listening.